In osteoarthritis, the cartilage get wear away. We sometimes hear people say it's wear and tear of the joint, and that's lead to osteoarthritis. What that means is that when we are loading our joint abnormally, the forces going down to the cartilage increase significantly, and that will cause damages to the cartilage. The exact mechanism of osteoarthritis is not understood, but we know that there's very different treatment options that we can do to improve osteoarthritis. The aim of cell therapy is to help and enhance the body biology to help the cells to repair our own body. There are very different methods that we can do to treat the cells, whether that we replacing cells with different cells, for example stem cells or cartilage cells, or perhaps we could do something that will enhance what we got in our body. So we can use growth factors, we can use different man-made synthetic factors that can help our cells to regenerate and to recover. And also with chemicals and with drugs, we will be able to modify the environment around those cells and to potentially turn them back to their healthy state or maybe help them recover. And that is the main aim for cell therapy. There are many different types of cell therapy has been developed. So when we look at things, we want to look at the cells itself or the environment around the cells. Within the cell therapy is we actually can use stem cells, or we can use adult stem cells to enhance our body, or we can use growth factors such as PRP to enhance these cells in our body. Or perhaps we can use a man-made molecule such as hyaluronic acid, which will help the environment around the cells to give them the nutrients to nurture them, so therefore it will help recovery. The advantages of cell therapy over other treatment is that it's biological. This is something that we're using our own body tailor-made for our own self. Instead of putting metal, plastic and other sorts of tissue such as animal tissue or maybe some man-made tissue, I think the best thing to do is you can use our own body to heal ourselves, and that is the ultimate aim of cell therapy. There are different evidence out there for cell therapy. There depends what are we looking at. In some sectors of cell therapy, there's over 20 years of experience and many randomized controlled trials to show that it is superior compared to traditional, say, microfracture. There are also studies suggest that it makes no difference. Now, this is very important for the clinician or for the patient to do their research properly, understand what the study is actually looking at, perhaps be involved in one of these studies to understand what is the inclusion criteria, exclusion criteria, so we know what actually works and what actually doesn't work. By simply typing the word cell therapy on search engine, we'll come up with a lot of, I would say, random facts. I think it's very important to seek professional advice and discuss with them about what evidence is there. Does that actually suit your needs?